Hey, everybody, we'll give everyone a few minutes to join. Welcome. Thank you for joining us for sharing the caring family resource centers and healthcare partnerships. I am Lakeisha Ross, the membership and events consultant for NFSN. I will be your mediator for today's webinar. If you are joining us online, you may listen directly through your computer speakers. If you have joined via the phone number that Zoom provided, your line has been muted to minimize background noises. For those of you online, please note that the link to the Dropbox folder is in the chat. Here you will see that there are some handouts available for you to download. In addition, you may put questions in the questions section at any time. The chat section is open for you to include any comments during today's webinar, but we ask that you direct all your questions to that Q&A section of the Zoom. Live tech support is in the room today. If you have any issues with tech, please reach out to them and direct message them. Today's PowerPoints, the handouts, and recordings of the webinar will be available on the NFSN's website and the Webinar Wednesday page this time tomorrow, so you can check back there. When you exit the webinar, an evaluation will immediately pop up and appear. We ask that you take a moment to complete this, as it provides us with valuable feedback to inform us for future webinars. I'd like to say a thank you, a large thank you to our co-sponsors today, CareSource. We appreciate them valuing the work healthcare providers and FRCs are doing across the nation. Again, my name is Lakeisha Ross, and I am the membership and events consultant at the Support Network, and I'll be your mediator for today. Okay, so to get us started, I would like us to do a couple polls. Our first poll is, where are you joining us from? I want to know who is all in the virtual room with us today. Let's launch that first poll. All right, so where are you joining us from? Look at this map on your screen. Are you from the West, from the South, Midwest, Northeast? Take a few moments to answer. Let's wrap this one up. Can we see those results? A really good mix in the room, but let's see who won. So it looks like 30% of West and Midwest, and the South is coming in second, and then Northeast. They almost tied up with Midwest. So thank you so much for doing that poll. We have one more poll. Well, actually two more polls. Our next poll is, what is your affiliation? What is your affiliation? Are you a family resource center, a family resource network, other? If you're other, make sure you get in that chat so I can know what other stands for. Let's see. I'm not sure this is the right poll. Hold on. Let me see. Tech, is there one other poll? I wanted to see if there was some healthcare providers in the room. If you are a healthcare provider, go ahead and click other and let me see who all is in, and let me know where you're coming from.
Yeah, let us know in the chat.
Yeah, in the chat. Let me pull up the chat too so I can see who's all around us. Okay, healthcare providers. I see Maryland Department of Health. Awesome. Unity organizer. First things first, Arizona's in the house. Children's Hospital of Alabama. Yay. I'm in Montgomery, Alabama. Shout out to the Bamians. Life coach. Great, great. Let's close this poll and just see if anybody else answered the poll. We'll share those results real quick. We have some parent leaders in the room. That's awesome. Some government and child welfare in the room. So a very diverse room. Awesome. Great. One last poll as promised. So what level do you work at? What level do you work at? So are you a policy systems level, individual, management level, program or direct service level, or other? And if you choose that other, make sure that you put it in the chat what that other is. We'll give a few seconds for everybody to be able to answer all of the above. Okay. Awesome. Family Resource Center supervisor, research and evaluations, program coordinator, other wash windows, address. Awesome. I'm loving the diversity in the room. Great. Okay, I'm going to close the chat real quick and we can show those results. Okay, so it looks like majority is the program and direct service levels. Awesome. And then some management and policy and systems level. And then, yes, we saw a lot of other in that chat box. So thank you so much for being here. I appreciate it. Awesome. So just a little bit about the National Family Support Network. So founded in 2011 by 8 state networks, and over the decade, NFSN has quadrupled in size to now having 38 member networks, 37 states and DC that represent more than 3,000 family resource centers that serve more than 2 million people annually. The newest member is Minnesota, who joined back in December of 2022. NFSN's mission is to promote positive outcomes for children, for all children and families and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. NFSN's vision, that map that you just saw in the previous slide, is that the whole thing is green and that families will have access to quality family support services in their communities, provided by FRCs, supported by strong networks. So here's just a little brief overview of everything that we're going to cover today. So we'll start off with just a little introduction about FRCs. Then we'll have some wonderful presenters share with us on family resource centers and healthcare partnerships. We'll have a presenter from Troy Resilience Project from Alabama, Children's Wisconsin Black River Falls office, and then we'll have Family Care Connections, UPMC, Children's Hospital of Pittsburgh. Then we'll wrap it up with some lessons learned by these panelists. We'll do a Q&A session. And I will wrap us up with some NFSN resources and opportunities and the evaluation. Let's get started talking a little bit about family resource centers. There are thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as Americans' best kept secret. A family resource center is a community or a school-based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. They may be community-based, like the image on the left of a family resource center in Vermont, or they may be school-based, like the image you see on the right from Kentucky. Settings like image that you see on the left from Colorado, or urban settings like the image that you see on the right here, which is a family resource center in the Bronx of New York City. Wherever they are based, family resource centers work with families with an approach that is not only two generational, but multi generational, strengths based. These concepts is important. Have you heard of two generation rational or two gen work? Well, family support is the original, not just two gen, but multi gen work. As programs work with children, parents, grandparents as well, based approach, because we see families as having strengths that we want to support them to build upon. And then it's family centered because everything we do has family at the center. They are designed for all families, not only low income or highly challenged ones. So the support they provide is non-systemic, making it more readily accessible. Programming is provided at no cost or low cost for participants. The image to the right is a family success center in New Jersey. There are 57 family success across all of the state, 21 counties. Each county has at least one, and typically more than one, family success center. That includes highly affluent counties as well as highly challenged counties. Because, and again, the belief is that all families can benefit from an access to support for two of the most important roles we can play as an adult, being a parent and being a spouse or a partner. Two of the most important roles we could have, for which we typically have no support or training on. Hence the value of universal access to family resource centers. Okay, so audience, I want to see a show of hands. How many of you have heard of the protective factor framework before today? Probably a lot of you, because I definitely saw that in the chat box that a lot of you are around the family support. Awesome. I'm seeing a lot of thumbs up. Thank you so much. Yes, they come from the Center for the Study of Social Policy. Research has shown that these 5 protective factors increase family stability, enhance child development, and reduce child abuse and neglect. So as we were working with families, we want to support them to build these protective factors because we know that they have a positive difference on their lives. So the 5 protective factors are like you see on the screen: parental resilience, social connections, concrete support in times of need, knowledge in parenting and child development, social and emotional competence of children. They make the difference for our families. You can read about this at the CSSSP website. As conveniently located hubs, they bundle and co-locate many services that may be familiar to you, such as home visiting, evidence-based parenting education, health screenings, playgrounds, fatherhood programs, family counseling, food banks, and more. Despite their organic development and varied funding sources across the country, there is remarkable similarity in their most common services in service areas. These are the top 4 base of research funded by the Robert Wood Johnson Foundation. So these are the top 4 common areas. parenting support, which exists on a continuum from lighter touch to more intensive services, access to resources, which also exists on that continuum from lighter touch to more intense services. Then you have activities focused on supporting children's healthy development, activities supporting parents' leadership development, and as a parent advocacy committee. And FRCs are not only providing programs, but building communities and peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. Sorry, I moved us ahead. Got excited. So here we go. That was just a little bit about Family Resource Centers. So now the most important part of today is our presenters. I would like to introduce Miss Elizabeth Dawson with Enterprise Pediatrics and Troy Resilience Project from Alabama. And I also would like to share with you, after Miss Elizabeth goes, she will pass it to Miss Julie Woodbury, the Family Prevention and Support Manager with Black River Falls office in Children's, Wisconsin. With her, she will have Miss Norma Jean and Miss Desiree. And so we are super excited to have them as well. Once they wrap up, Miss Julie will then pass it to Miss Charlotte Bird, the Senior Manager, Family Care Connection from UPMC Children's Hospital of Pittsburgh, who is going to wrap us up with our presenters. So right now, I would like to send it over to Dr. Elizabeth.
Thank you. I'm so happy I wish I could see all of your faces right now, but I'm so happy to have this opportunity to present today. So I am a pediatrician in rural Alabama and founder of Troy Resilience Project. I've always had a heart for working in the community to expand the possibilities of improving child health. I recognize even back in medical school or before that physicians and medical systems can offer much more by connecting to our community resources. And now that I'm practicing in a rural setting with limited resources, it really made it more evident for me. So today we're going to walk through the Troy Resilience Project's journey to increase the connection between medical practice and the community. We're a small clinic and we're a small family resource center. Our story is a little bit different from some of the other presenters today, but I think it shows what's possible. Okay, so many of you out there may be familiar with this pair of aces slide. And I like to say it didn't exactly all start with a pair of aces, but the beginnings of our Family Resource Center did. So the clinic where Troy Resilience Project started has always had community connections and has always done a great job of serving the needs of the pediatric population. They strove to break down barriers, provided healthcare access like co-locating mental health services, having sliding scale fees, and offering services well beyond the typical clinic. But when I started learning about the ACEs and all of the things that that encompasses and all of the really significant impacts on child health and well-being and lifelong outcomes, it really had a tremendous impact on me and what I want to do with my medical practice and my and the work that I was doing. So as you look at the pair of ACEs, so we think about the adverse childhood experiences, which of course involve abuse and neglect and parental mental illness, maternal depression, but also and things more individual things like domestic violence that may be witnessed or homelessness, but also the pair is really that adverse community environments. And so, you know, things like poverty and poor housing, these are really impacting kids' developments as well as adults and how well they're doing. And so it became clear that even though we were doing great work in the clinic to connect our families to resources, that this was something very large, and I needed to work across sectors to address the problem. Next slide. So initially, we started off doing something we termed expression sessions, and so we wanted to come up with ways to relieve the toxic impacts of stress on the developing body and brain, and so we had some foundation grant funds that we used to start these expression sessions in the clinic. So we did Zumba and yoga and art in the clinic. We made it available to all of our clinic patients as well as to the community, and we advertised in the community as a way to offer really an alternative to traditional mental health, which for really little kids, we all know there's some struggles getting them connected to services, and some families just aren't ready to do traditional mental health, or sometimes there was an access issue, and so this was kind of the beginning of the early part of being a family resource center, was trying to offer some additional supports to our families. Okay, next. And we really worked to, obviously we recommended, I mean, all kids can benefit from all of those services, but anyone we were identifying with having toxic stress, we really, really strongly encourage them to participate in those. And then in 2019, Troy Resilience Project begins. As I was looking at the impact that the expression sessions were having, we felt like we were doing a great job with that and that we were making some impacts, but there was no way to address all of the adverse childhood experiences and adverse community environments with doing some yoga and Zumba and art in the clinic. So I really wanted to bring together, can you go back? I really wanted to bring together stakeholders in our community, people from all walks of life, community leaders, professors, mental health, social workers, teachers, addiction specialists, administrators, law enforcement, church leaders, parents, and kids, and together start to create a movement in our community. So we had our initial kickoff screening with the resilience film, invited everyone we could think of in the community, brought stakeholders together, and in that room there are, I think, at least one person from each of those sectors who were represented. And I also had the great opportunity, which many of you are familiar with, children's trust funds throughout the different states. And so I started learning about that organization and what they do throughout the state. And that was really a key to expanding our work. And we also became a pilot site that year for screening for adverse childhood experiences, which kind of moved our movement forward to know that there was so much stress and adversity out there. We really need to continue to do what we could to bring sectors together. Okay, next slide. So we had our kickoff. We're having regular meetings, bringing together different folks in the community. And after several months, we decided it was time to start having some community events. So we partnered with a local church who was doing what they called neighborhood hangouts. And so we offered to partner with them and again, screen the resilience movie, bring together kids, do some of our expression sessions that we've been doing in the clinic in a school setting. And it was a great success. We brought a lot of different community members together. But that was in March 1st of 2020. We all know what happened shortly thereafter was already happening. We had the global pandemic, so we really had to shift gears for our community outreach and do more virtual stuff. But fortunately, we had connections in the schools and we had a virtual platform, and Zoom became prevalent, so we were able to continue our work there. Okay, next slide. And then we were fortunate, as I said earlier, we had learned about the Children's Trust Fund of Alabama, which is a funder of many child abuse prevention programs throughout the state. And so we applied for our first Children's Trust Fund grant, and it was granted. And so we started our Healthy Steps program in fall of 2020. And many of you may not be familiar with the Healthy Steps program, but essentially it's embeds a family support specialist in the primary pediatric clinic. And so it was a great way to start addressing the myriad of needs that our patients have. And it's on a tiered service delivery model. So we were able to, the ones who had more needs, we spent more time with. And it was really a huge addition to our ability to start meeting more needs in our community. Okay, next slide. And then, but it was one person. So we went from a lot of contract part-time volunteer folks to one full-time person to address, all of the needs of every family in the community. So obviously this wasn't enough. So we decided, okay, we need to add some more services. And as Lakeisha had referred to earlier, as we're learning about different ways of delivering services, we wanted to add some parent support and kid support in addition to our expression sessions. So we started getting trained myself. We had a fabulous intern that had started that's now an employee, and our Healthy Step specialist. So we all started learning about different parent support classes. We didn't really call them classes. We call them parent support groups because parents, they don't really want to go to class, but so we try to really encourage them that this is a way for parents to get together and learn together, share resources. So Circle of Security is one example, but we have several different parent supports that we're able to implement with our staff. And then also adding some trauma-informed therapies. Smart Moves is a sensory motor based therapy that's kind of an adjunct to our mental health resources. And for kids who are pre-verbal or had pre-verbal trauma, we can use that as well. So we added that and basically anything we thought of that would help kids regulate their emotions and sensory to help them perform better in school and help them make better relationships. But we also had the parent support component, which was in the Healthy Steps program, and additional parent supports. And so we're growing, and as we grew, our need for space did as well. And so we went from our contract folks to our full-time, and this is our current crew. So we went to from no full-time employees to 5 full-time employees in 2022. So one of the great things and kind of points to take down for those who are trying to figure out how to connect or to add their services is, these at Children's Trust Fund of Alabama, we have a great grantee training. And so that's where I learned about family resource centers. So I'd never heard of family resource centers, been practicing pediatrics for a long time. I probably had seen a couple, but I didn't really know what it was all about. Once I started learning about that, I said, hey, this would be a great way for us to expand our reach, improve our service delivery. And so I reached out to the Alabama Network of Family Resource Centers and was fortunate that they were starting a 101 training program. And so we got involved in that and were able to become a member in 2021. So we were so excited about that. And so it enabled us to, again, continue to expand our reach, add to our services, add to our funding sources, so we could add things like workforce development and network again with other family resource centers, other Children's Trust Fund recipients to add services and improve our ability to reach folks. We also have a food pantry in addition to our parent support resources. We've started doing financial classes. So there's a variety of different services that we offer and always trying to add services as need be. And we are also present in our schools having our mental health. We supply the mental health services coordinators for our local school system. And so you can see how the growth through the guidance of Children's Trust Fund and Alabama Network Family Resource Centers, we've really been able to expand what we're doing. Next slide. And so one wonderful opportunity that we found on this journey of me being a pediatrician and interested in community pediatrics, adversity in childhood, and how we all can come together to address adversity to improve child health outcomes in the long term, has been that is my goal is to bring together other pediatric offices with resources that I've been learning about over the last year. So there was a wonderful opportunity, a grant funded opportunity with collaboration between the American Academy of Pediatrics and Healthy Families America. So they offered a grant that was nationwide. So we were one of 3 states who participated in this, or only 3 states were granted funds for this. And what we did is we really wanted to bring together our pediatric medical home offices with our parent resource providers, because much like myself, I knew some of the resources in my community, but I didn't know there was this whole network of home visitors and parent support specialists throughout the state. And so our goal was to bring together different pediatricians and pediatric offices throughout the state. And so we only had 6 months to do it. So in 6 months, we were able to have these roundtable discussions spread out across the state. And as you see in the photos here, we had several priorities. We really wanted to spread out our pediatricians amongst our home visiting and local service providers, and have a goal of creating partnerships to strengthen families and communities as an extension of the pediatric medical home. So we see these folks on a daily basis. We see the folks who are struggling. It's beyond our typical capacity to be able to meet all those needs. So how do we link up our pediatric offices with these programs that are out there? So we had table discussions and share backs, and we were able to bring together 28 pediatricians across the state and over 90 service providers in these roundtable meetings. Okay, next slide. And so we learned a lot through this collaboration. And so I think this quotation from one pediatrician highlighted there at the top. I had no idea that the service for my patient was offered in my community. I've been practicing here for years. And so I think this is really a call for all of us in either sectors, the Family Resource Center sector or the healthcare sector, is that we really have to figure out ways to bring folks together so that we can connect the service providers with medical practices, because we're seeing all these folks who need so much and so much beyond our capacity. And so I'm excited about our next steps with this project. So it was a brief project, but our state AAP chapter is very invested in this work. And so in the next, in our 2024, we are expanding this work to continue to bring family resource centers, home visiting programs, other programs across the state with our pediatric providers, because as we're working for our QI project to address adverse childhood experiences and create more trauma-informed practices, we are coming together to address this, and we need our family resource centers to do this. Pediatricians aren't going to be able to do this work on our own. So we are very excited about what's to come. And I think this project that's coming up is really reflective of kind of the work that I've started in Troy, but now I'm excited that that we're seeing this go more statewide, so that more pediatricians can have access to all these great resources. All right, and here's my contact information. So please reach out if you've got any questions. That's our website, and I'm so grateful to Children's Trust Fund of Alabama celebrating 40 years, and Alabama Network of Family Resource Centers for all of their guidance throughout our process, as well as the American Academy of Pediatrics Alabama chapter, who have also supported all of this work. So that's a long journey, but I'm going to hand it over to the next presenter. Thank you.
Thank you so much, Elizabeth. I'll hand it over to Julie.
Hi, good afternoon. My name is Dr. Julie Woodbury, and I am the Family Preservation and Support Manager for Children's Wisconsin here in Black River Falls. We cover programming for Western Wisconsin. You can forward this slide. We are Children's Service Society of Wisconsin was founded about 128 years ago or so as an orphanage. We became a subsidiary of the Children's Hospital and Health System in 2004. We've rebranded to be Children's Wisconsin. We are the largest and oldest provider of community, child, and family-based services in the state of Wisconsin. Our main campus is the hospital and corporate center in Milwaukee. Our community services arms are all over the state of Wisconsin. We do child and family counseling, family preservation support, treatment, foster care, and licensing, child welfare case management. We have child advocacy centers. We have a statewide spread. And our services combined with the medical services truly give us an opportunity to concentrate on family and child health and well-being. So that's a unique, it gives us a unique perspective on helping families and children. Slide. Next slide. Sorry. So our family preservation and support locations are, like I said, statewide. Our office is in Jackson County. We cover almost all of the counties on the left side of Wisconsin. It's a large area to cover. We're kind of, we're very, very rural, but we do have core service areas. Each office has its own set of programs that they provide based on the location. Slide. So we have 7 family resource centers throughout the state of Wisconsin. 5 are in rural settings, 2 serve a combined urban and rural setting. Each location has its own leader, team, and staff, and the programs are based on what each community or location needs. Most of the family resource centers have access to ARPA funds or different grant funding or funding from the hospital system to help with basic needs, concrete supports, that kind of thing for families. And then the funding sources also vary by location. Okay, so like in Black River Falls, our prevention programs, our core service areas fall under home visiting. So we have 2 different home visiting programs. Our family preservation and support programs are family support. We have 2 different types of family support programs. So the home visiting programs focus on families and children with children less than 5 years old and parent-child interaction, that kind of thing. Our family preservation and support programs are kids from 0 to 18. We work on emotional regulation with kids, social skills building. We have programs that work on parent education. We have supervised visitation. We're working on reunification with families, all sorts of things. And we have a family connections program that works on like community health navigation for people that need to access healthcare systems directly that we don't have here right in Jackson County. And then our Family Resource Center is, as explained earlier, all access programming for any family with vulnerable children that would need access to something, any type of resource. So I will turn it over to one of our parent caregiver leaderships, advisory board members, Norma Jean.
Hi, I am Norma Jean. I have 2 children, Calvin and Elsie. Calvin is the little blonde hair boy. on the right, and then Elsie has the brown hair on the left. Calvin is now going to be 6 and Elsie is going to be 5. Elsie has quite a history through hospital systems and everything else. She was born 3 months early, so she's been in and out of the hospital. And then she was in the NICU from May to July of 2018, and then she had failure to thrive in September, so she was in the hospital for a week there. And failure to thrive is basically when they're not gaining weight enough or not eating enough to maintain a weight. And then she was readmitted to the hospital in December when she was shaken. Her diagnoses after being shaken were she got diagnosed with acid reflux and GERD, and that kind of goes hand in hand with the failure to thrive admittance. She has seizures, cerebral palsy, traumatic brain injury, a visual impairment. So she had enough damage in the back of her brain where your eyes, because in the back of your brain is where your eyes function. So she had enough damage there that caused a cortical visual impairment. She has developmental delay. She needs a feeding tube, and she has sleep apnea. I first got involved through Children's Hospitals through the Healthy Families program, and our home visitor helped us with a variety of things, such as getting a tucker sling and a wedge for the acid reflux and the GERD. Because when she was discharged from the hospital, we were basically given a list of the things she needed, but we weren't told how to get them or how to pay for them or where to go at all. So my home visitor helped us find where we need to get that. Our home visitor had also helped us with gas cards to get to her appointments in Rochester. Our home visitor had also brought us back and forth for some of Elsie's Rochester appointments. And she helped us find some durable medical equipment suppliers. So all of the stuff she needs for her feeding tube and all the stuff she needs for her sleep apnea machine, she helped us find suppliers for there because, again, the doctors didn't really help. And whenever Elsie had multiple issues, she helped me make a list of what was most important to talk to the doctor about at that time. So that way it would be more organized when we did talk to the doctor. That is all I have, so I'm going to hand it over to Desiree. We're going to have to go to the next slide.
Hi, everyone. My name is Desiree Rave. As you can see on top there, it says Meet Aja Hoinga. I am a tribal member of the Ho-Chunk Nation, and I am also the Family Resource Specialist for Children's Wisconsin, and I am primarily in the Taylor office, but we are based from Black River Falls out of Milwaukee. And our location is very unique. And before I go into that, I wanted to just kind of introduce this picture. I am a single mother of, can you go back, please? Yeah. I am a single mother of a 5-year-old boy, Elias, and today is his birthday. Happy birthday, Elias. And then I also wanted to introduce my daughter. She is 2, and she is on the right. And I wanted to just talk about our location right here in Jackson and Trempealeau County. We serve different communities, and this includes the Amish, the Ho-Chunk Nation, and our Spanish-speaking community, which is based primarily in Arcadia, where we see a lot of our clients at. And next slide, please. So as you can see on this map here, Black River Falls is right next to the Ho-Chunk Nation tribal headquarters. We are pretty much neck to neck with the Ho-Chunk Nation. We have many partnerships, and I want to say like maybe 50% of our client enrollment is all Ho-Chunk Nation. And down the road from Black River Falls, our Amish community is right there on P. You can see a P right next to Black River Falls, and that's kind of where our Amish community is. Next slide, please. So I have, personal experience navigating the Ho-Chunk Nation, the healthcare system, which we have the House of Wellness in Wisconsin, Dallas, Wisconsin, and then we have the Ho-Chunk Healthcare Center in Black River Falls. And being a tribal member of the Ho-Chunk Nation and all the culture and tradition that come with my experience, I'm able to guide our staff with our current clients that we currently serve. We have partnerships, including the maternal health program, which is in the community health program. And we also have, for our Spanish-speaking clients, we have been able to navigate using the interpreter services, which we kind of just were getting used to over this past year because we've had many referrals come from only Spanish-speaking clients. And it's been very challenging having that interpreter because we don't have that in-person bilingual worker to work closely with our families. So it's been very unique, and we've been getting more familiarized with that. And we started a close partnership with the Amish over the last, I want to say, 6 months or so. And that's all thanks to our, my coworker, Michaela Conlon-Bew. And she was also able to host a recent car seat exchange with the Amish. And what is also very important to point out is that the Amish falls where they go for their health care, and that's called Footprints, also known as natural healers. So for our all of our programming that we have, we screen for these concerns, and that's how we connect our families to healthcare around this area. We want to get them the best and safest care, and it takes putting puzzles together to get our clients the best care possible. Sometimes these concerns that we screen for healthcare especially, we connect to other clinics that are like 45 minutes away. So La Crosse and Eau Claire in this area is probably like the closest for very urgent needs. And normally that creates a barrier because transportation is very huge in this area. You know, if somebody doesn't have a driver's license or can't afford gas to get there, Children's Wisconsin has been able to navigate assisting with gas cards or using our own transportation to help our clients get there. And Children's always just wants to make sure that their needs are met. And then as a employer of Children's Wisconsin, I learned a lot as a mother. I came into this program, I didn't even know what ACEs were when I first started. I didn't know that I had them. And it's helped me through, like, as a single mother, I had a childcare crisis where I couldn't come to work because my children didn't have childcare. And that's very hard to find around this area. There's long waiting lists, maybe a year waiting list. And going to my leaders in this organization and asking for help was the best thing I could do for my family and being able to continue working with Children's Wisconsin. And I also wanted to say I've been able to understand how important mental health is in this position working with other families. I keep my mental health top priority. And since I made that a priority, I stress that to everyone I meet along the way, how important it is to ask for help and how important it is to keep our health top priority as parents so we can care for our children. And as a home visitor, I've also been able to help families through my own ACEs and being an advocate to them in maintaining the best and safest care. This organization helped me understand that starting each kiddo off with healthy parent-child interaction can give them a good start in life. Next slide, please. So these are some of our programming that we have with Children's Wisconsin in the Black River Falls area. Right next to me, Norma Jean, she is currently with the Caregiver Leadership Group, and we have done many clothing swaps, and that was very, very successful. She's also just launched a special needs parenting group, which is set to begin here, where she's going to be making more events. And then the homelessness navigator is our kind of our top priority right now with our new program opening up. We also offer LGBTQ groups for anyone in our area that needs that extra support. Next slide, please. And, you know, like it says at the top, it does definitely take a team. The FRC works as the bridge to connect people to healthcare resources, and then these are just a few of our staff members from our team. And we want to thank you for having us.
Thank you so much, Desiree and Norma. We appreciate it. All right, at this time, I am going to pass it to Miss Charlotte. And Miss Charlotte, you're muted.
That's right, I am. Sorry. My name is Charlotte Bird, and I'm Senior Manager for Family Care Connection, a part of UPMC Children's Hospital of Pittsburgh. Next slide. Children's Hospital is it has 313 beds, 21,000 plus admissions and observations, 24,000 plus surgeries, 160,000 plus emergency and urgent care visits, and 1.4 million outpatient encounters. And they also have 6 community-based family support centers, which that is what Family Care Connection is. We served 1,840 families and 2,850 children in 2022. Next slide. We are a family resource center, strength-based, just as all the folks on here are. And our whole aim is to make sure that we can meet the needs of the families that we serve, and for the children to have a brighter future. These 6 centers are operated by UPMC and also is a part of the Allegheny County's network of 27 family centers. And I can say that with Dr. Dawson and also the folks from Beaver County, we started slow first. We had one center that was located in a clinic, and that was done by a pediatrician, and a grants from Heinz Endowment and the Department of Human Services, Health and Human Services, that said that, you know, we needed to do more, think outside the box of the medical wall. And so that's actually how we started, with one clinic and the services that we provided. And then we grew to 4, and these 4 other ones were also in areas that at that time in 1989, that's when we started. So we're about 34 years in. And so the pediatrician at that time and the executive director of human services knew that there was some concerns that in order for people to continue to stay well, they needed social supports to help them do that. Next slide. So we are a part, FCC is a part of UPMC's Children's Hospital of Pittsburgh Division of Community Health. We focus on 4 areas within the whole division, and that is health and prevention, which is also talking about healthy schools, healthy out of school time, healthy early childhood, youth violence, injury prevention programs, trauma sensitive schools. We also is where we sit, Family Care Connection is family and social support needs. We have a basic need fund from various grants that help parents out with car repairs and with other things that the case workers that are on their cases, when they're talking to the parents, ask what their needs are. And we also have the Family Care Connection, which is we work with maternal health, infant and toddler development, parent and family development, behavioral health programs, school readiness. Then the clinical community connections. Inside the hospital, just as Norma talked about her story, there are families who are definitely have needs beyond some of the social workers' capacity. So we have a team there that helps with food security, asthma management, family support, social needs, community health-based hubs, and working with the youth zone. We also have outreach, education, and training. And this is really pediatric rotation within the communities, exposing the residents and other new hires that come into the hospital about the community and the resources that are available in the communities. And so we have a rotation for the pediatric residents that come on board and visit our centers and also go into our home visiting pieces if the families will allow someone to come into their space. We also work on the pursuit policy system and environmental change. Next slide. UPMC Children's in the Community, we work together with healthcare and community partners to improve the health outcomes and reduce health disparities and elevate the quality of life for children and families in the communities where they live, work, and play. And this is all guided by a community needs assessment that we give out that's conducted every 3 years. Next slide. This is an organization of how kind of we look. UPMC Community Health Division is under the Vice President of Medical Affairs, and he reports directly to the President and CEO of Children's Hospital. So we have project administration, budget analysis, we have our director, and we also have a medical director. And on the left, you will see that family social needs, and that is FCC. And those are all the people that are involved in my project. And then the clinical community connections, which I just talked to you about. We also have health prevention that we also focus on. We want to make sure that we have mindfulness classes, nutrition classes for families, literacy classes, all those classes that some of the other folks have already talked about. Outreach, of course, that's where I was talking about. We're always continually doing outreach and education and training for both our families and for also our coworkers. Okay, next slide. We all know the social factors that influence health, food insecurity, financial strain, intimate partner violence, training and employment, housing insecurity, childcare, behavioral health, transportation, education, and utilities. Next slide. So the key initiatives that we focus on is maternal and infant health is one. And we have we got a grant from the Department of Human Services, the county for Allegheny County, has a new program that they just introduced right before the pandemic. And that is to have more access for moms that are having their babies to be able to know that there are resources in the community that they can connect to. So we partnered with them These moms know about it in the hospital, from nursing to social workers to kiosks. So they find out about it. But also after they have delivered their baby and gone home, they are also given a postcard that asks them if they would be interested in finding out more about resources that they could have, or if they want to opt out. And they have that right. If they want to opt out, not deal with that right now, because they can always come in at any time. But for those who do, we have outreach team that goes and that talks to them to let them know what concrete goods are available, like diapers, formula, baby clothes, and things for their other children. So we try to get them connected to a resource, and this is for the whole 27 Family Resource Network. We try to get them connected to one that's close to their area that they live in. And we try to make sure that they will be a part of anything that they want to. If it's just a drop-in, whether or not they just want to get the concrete goods, or if they want to do programming, or if they want home visiting. So we offer those array of services for them to do that. Basic needs support, that is if you need a car repair or any of those other things that I talked about before. If you want to access that, you have an opportunity to do that. Parenting support and service coordination. All of this is just to strengthen families and improve health outcomes in the communities with high rates of poverty and infant mortality. But we've shifted because it's not just that group, it's anyone who needs help nowadays. After the pandemic, it showed us lots of people had needs. And so we are standing on that platform, that it can be for anyone that needs assistance. Next slide. So this is our Family Care Connection. These are the programs that we service: pre and postnatal education, infant toddler development, early education, child development screening, adult and parenting support, fatherhood engagement, health and wellness programs, family development, family checkup, which is a behavioral intervention evidence-based program, and dental pop-up clinics, and family and community events and educational field trips. Next slide. So one of our centers, which is in the Hilltop area, also has involved with that a healthcare piece the Department of Human Services, Allegheny County, had a community initiative. And so we applied for that and got that. And that was to increase high quality healthcare while connecting families to existing community services. So we actually service in this environment children from infant to 25 years old. And they can come and get their immunizations. It started out as once a month, and it has now it is at 4 times a month, weekly. So it has been a real huge success. The barriers to them getting to the clinics and to the hospital was transportation. And so basically our center is, our family center is based right on the bus route. And so that made the no-show rate for the clinic go down drastically. And it increased the access to high quality healthcare while maintaining a consistency with working with these families for their health concerns. The ripple effects was a utilization of preventive versus emergency healthcare. And then we have a behavioral therapist that sits there. So it's a direct referral to that area and also to our family center area. So it's kind of like a one-stop shop, because it's also within a area that has a dental clinic, a baby, infant, a child clinic, primary care area, and also WIC. So that's a dynamite effect for that particular center. Next slide. We do our assessments every 3 years, our community health assessments. And one of the factors that came out was that instead of to cut down on the emergency visits for folks and children that were having asthma, we adopted this program that one of our nurses will do asthma education for anyone that comes into ER. So that is given over to us after, of course, the ER takes care of the concern. And then they're also fielded to us so that, we can give them asthma education, family support, community resources. Even in some cases, we've done some home modifications. So this has helped out tremendously with the asthma piece in the Pittsburgh area. And this is for our 6 sites. Next slide. The clinical community connections, as I talked about before, and again, I will, refer to Norma's story. There are families that are right in the Children's Hospital now that need some immediate assistance, and the social workers that's there, they're at capacity and they don't have access to some of the things that are out in the community. So we knew that there was a need for this assistance within the hospital. So, and this is also located within the area where the health hub is. So it blends very well with that. And she connects them even when they leave out, they are connected with community resources that are within their area. Next slide. This is our amazing team. We have in each site, we have a program coordinator, we have an RN, we have a child development specialist, we have family development specialist, we have a community aide. To complement that centralized, we have a father and male initiatives. We have a health and wellness program coordinator, and we have a behavioral health specialist. Next slide. This is a quote from one of the first-year pediatric residents that I think is really, really exciting. He said, many of the children and the families we meet have resource disparities that have a larger impact on quality of life than any therapy a doctor can provide. FCC helps supports these needs. Next slide. Thank you so much for listening to us, and hope that you have gotten something out of this. And I turn it back to you, Lakeisha.
Yes, thank you so much, Charlotte. We appreciate it. It was awesome. All right, so to get us to continue talking about this, since we have all the experts in the room, we're going to talk about lessons learned, and I am going to pass it over to Julie to walk us through this. But any of the other panelists, if you want to talk a little bit more about it, feel free to come off. And Julie, you can start us up with lessons learned.
Okay, so lessons learned for medical systems and physicians to best serve their populations and support them to reach optimal health and well-being. It's essential for them to connect families to resources that will help them meet their needs. The way we have found that's most effective is to actually, for lack of better terms, handhold and walk people through that process. There are many ways that FRCs bring value to healthcare providers and systems and ultimately families. So align FRC values with healthcare providers' priorities. So checking with the providers to see what their priorities are and making sure that the FRC aligns with those values is helpful. One thing we do here at Children's is making sure that we're asking what's important to you, asking every family or client or even kiddos that come through the door, what's important to you today? How are you feeling and how can I help? So those are questions we make sure we ask. And then, of course, patience is the key. Be patient. It might not be a need today, but it may be a need tomorrow. Someone may not be able to ask for help today, but they may tomorrow. So being patient at all times is definitely the key. So those are some lessons learned.
Thank you
I-
so much, Julie.
Mhm.
Then we'll move to suggestions for getting started. So I will pass this to Elizabeth for some suggestions.
Yeah, so for healthcare providers and systems, we really want to reach out to those existing family resource centers to see what's available. And then following, after you've assessed the needs in your population that you're serving, you want to find out what's important to the family before providing services for them. And then for the FRCs, building relationships with the healthcare leaders and make sure they know how you support your families and how you can take some of the pressure off clinical providers. Everyone is stretched. So yeah, as much as the provider knows that this is going to be something that will help them instead of add more to their to-do list, I think is a key way to approach it. And then for both, great things take time. So start small. But do start.
Yes. And I will also say that building relationships with healthcare leaders are very important, and show them how what you do aligns with what they are doing. Because as an example, even though we are part of the hospital system for so long, we were like kind of separated, okay? And so we were separated because we were this program and they were the big hospital. And so what we decided to do was we had programs, we would have what we call showcases, community showcases. Those community showcases, we said that they were actually for just, we took them inside the hospital, brought all of the partners like Community Bank, RX, Parks RX, all of these resources in the hospital and showcased them to the clinical folks. And they got a big kick out of it because they didn't know. They were at the tables, you know, like looking at all the different resources that they now felt comfortable to be able to reach out and refer to other, to their families. And also then the hospital began to look at us differently, to be very transparent. And so, you know, with all these health disparities now and us always knowing that this is not one thing that, as Elizabeth has said, this is not one thing that just a physician or a health provider can do. It's like the whole entire community. And so showcasing those things, and we align our goals with what the hospital goals are. And we do this every year. So we do service. We align our services with what the hospital's doing or what the hospital's goals are for the year. And so that is how they begin to see exactly what you actually do for the family resource centers. So it's really worked. And yes, absolutely. We're bigger now because we have 27 sites in Allegheny County. Yeah, that's nice. But remember, we've been in this for 34 years. And I wasn't there then. But great things take time. So start small and have your base of parents, because that has been essential. Parent leadership has been essential. When you include parents in what you're doing and what they want to be done in their communities, they feel as if they have a stake in it, and they do. We as providers always want to say, this is what you should do, but that's not it. It's their home. We don't want anybody to come in our home and tell us what we want to do. And the same respect needs to be given to our families that we serve. So I just want to say this: great things take time, and patience is very needed, but it is needed. Okay, these family centers and hospitals to work together. Collaboration is absolutely paramount to where we are as a society now and where we will be going further on. Thank you.
Thank you so much, Charlotte. All right, so Just a reminder that we have the Q&A section coming up. I see a few questions, but I want to give everybody some time to put their questions in the Q&A. So go ahead, drop those questions in there as I wrap us up, and then we'll come right back for the Q&A section. So you have time to do that. So just to let you know a little bit about what we have going on at NFSN, we have these webinar Wednesdays all the time. Our next one that's coming up is March 22nd from 2:30 to 3:45 Eastern Time. It's the Network Spotlight, Utah Family Strengthening Network. So come join us as Utah tells about what all they have going on and how it's similar or made different from you. So really excited about that one. The next one is April 5th from 2:30 to 3:45 Eastern Time. We have an overview of the standards of quality for family strengthening and support. So if you would like to register for those trainings, visit our website. We also have the standards certification training every fourth Thursday and Friday each month. The next one that's coming up is April 27th and 28th, and you can register by April 17th and register at our website. Another wonderful training that we have coming up is developing and sustaining effective parent advisory committees. The next trainings is April 20th and the 21st and June 27th and the 28th. The cool thing about this training is it's co-trained by an NFSN staff and an experienced national parent leader. So you should definitely join if you've never experienced this training. You can also register for that training on our website. Website is full of wonderful resources. We have FRC overviews, videos from the past, webinars that we've had, research reports, system level funding information. So definitely take the time to go through our website and the different tabs to learn a little bit more about what we have going on at NFSN. Then I also want to share with you, we launched the new FRC Learning Hub. If you haven't checked it out, you should definitely do. It's designed to provide tools and sample materials for those seeking to develop individual family resource centers. The hub is organized into the 6 phases of developing a family resource center, with each with accommodating resources. After you register via the web page, then you'll have access to those materials for free. So you can go and look at it anytime you please. And just a little bit about the services that we provide at NFSN. We facilitate connecting the NFSN member networks. We present for key stakeholders such as education leaders, child welfare leaders, Children's Trust Fund, which has been mentioned several times through this webinar, and many more. We provide technical assistance for Family Resource Center networks development. And then those 2 trainings that I told you are coming up, that standards of certification training, and then the developing and sustaining effective parent advisory committees. So you should definitely join in if you haven't already had joined us with NFSN to hear about some of the wonderful stuff that we have going on. All right, as promised, we're going to go back to that Q&A section so that we can answer some of those questions. Let me pull up the Q&A. All right, ladies, I feel like there is tons of questions up here for you. If I can get tech to spotlight all the panelists, so whoever would like to answer the questions could pop in and answer. The first question we have is, when you had a family support staff in your clinic, what were some of the more immediate needs you were seeing as needed services for families? And whoever would like to take this question, pop on off.
I would say for us, it was all of the social determinants of health type stuff. So utilities, food, childcare, domestic violence needs, transportation, housing. Once you start opening the door, that's an okay thing to talk about in the pediatrics office, and that it is important to their health. And we were doing some screening for needs. That's where where we came across it. Sometimes they were urgent, sometimes they were more ongoing, but at least you would have a way to connect them to resources if they did have needs.
Thank you, Elizabeth. All right, so the next question. Adverse community environment. Is there a screening form, as with ACEs, that we could access? It was a great concept. They loved it.
So the Pearls, which is available through the Center for Youth Wellness, they have what they call the traditional ACEs, which is the kind of the adverse childhood experiences, and then the I forget what they call them. They're like extra ACEs, and so that kind of includes more of the discrimination and all the other adverse community environments. I don't know if it covers all of those, but there's a lot more in it. And so it does separate those two out, but there's a they believe that they're just as harmful as some of the individual adversities. But if you go to the Center for Youth Wellness, I believe that you have to register, but you can access that for free as well.
Thank you, Elizabeth. So next question. Do you have any example documents of a community health assessment?
I know I can get that for you. That's not a problem. I think it's like about 4 or 5 pages. And some of the other folks might have a different one, but we have one, and I can get that for you, Lakeisha, so that you can send.
Perfect, thank you. And we'll add that to the handouts list. All right, so our next question is, are any of you connected to the Help Me Grow system? If so, what is the relationship like? Any of you panelists?
What do you think that one's for?
How do you get the parents to open up?
We do affiliate with that through our pediatrics work. So Help Me Grow Alabama, we send referrals to when there's developmental needs and that sort of thing. So we do affiliate with them as well as an additional resource.
Okay, and next question. Do you find that practices that have a care coordinator or social worker already on staff still benefit from an association with the Family Resource Center?
Yeah, I do. Because our community collaboration person, she works with our staff. Okay, she has the discipline of social work. Okay, our staff, our family development specialists may not have that particular discipline. So she helps us with navigating resources throughout the community and giving them a streamlined way to access it through different charts and different kinds of programs that we have. So she helps with that. So I don't think that that's a problem whatsoever to have a social work that's focused on that discipline, because ours were basically, they came from grassroots in the community, and we do still try to provide when there's openings with someone who they have to have an education background, but it doesn't necessarily have to be in social work. So we like to provide a way of our families getting employment through us. So yes, having a social worker, I think, is not a problem at all.
Thank you, Charlotte. So the next question is, what have been some of the ways you've included parents / obtained parents' feedback?
Oh my
Desiree, Norma, would y'all like to say something? Are y'all trying to say something right there? I'm sorry, I didn't hear y'all if y'all said something.
So with my home visitor, she helped me open up by just letting me know that she would support me through everything, and that really helped me open up, knowing that I had someone on my side to help push me get the things that I needed.
Thank you
And
so
I
much.
think for myself, oh, sorry. So I had a client that was very hard to open up with at first because she's had so many new home visitors over the course of her time with Children's Wisconsin. So for me, it was just not listening to respond, but just listening to hear her. Like, she just loves when somebody's able just to sit there and listen and, you know, just hear what she has to say and just sit with it. So that was a way that I was able to help her open up to me, and with her feedback and letting her kind of take control of how the conversation was going to go. So yeah, that was another thing too.
And for us, we utilize what we call the quality standards, okay, that came from Family Resource Center of National Support of America. And we, because we're always trying to work with our parents to become leaders, we actually had this evaluation tool so that they can evaluate us to see exactly where we fit, how we did, how we were doing. There were areas where we were not fitting the way they wanted us to. And so at least we had a conversation and we changed it. So having them have a part in leadership pieces within our within all of our sites was very, very good, and kept us all on our toes regarding of where we're at right now. Is, are we meeting the needs of the families that we actually serve? And bringing them into that was, you know, was really good and very insightful for staff to know. And we also had staff that were there with this. So it was staff and families working together on these quality standards to make sure that we are where we need to be.
Awesome. Thank you so much. We're almost at time. So the last question that was put in the QA box was, what vision or motivation do each of the presenters have to help them move forward in expanding their programs? So we have time for probably one person to share.
I can answer that. The motivation and vision of helping as many people as possible as we can. That is literally the thing that drives the programming forward here. That's what we do.
Thank you so much, Julie. Okay, so here is my contact information. Feel free to reach out anytime if you have any questions or need anything from us at NFSN. I would like to say thank you from this little one. Just a reminder that there will be a survey that pops up on your screen as soon as this is over. And I want to make sure that you take the time to complete that, because we really do value everything that you say. I want to take also the time to say thank you for joining us in this space and letting us have this conversation about how family resource centers and healthcare providers and systems can work together to better support families. And thank you, presenters, for all the amazing work that y'all are doing already, and that you were willing to share this with all of our participants. We really appreciate it. And we hope that another one of our webinar Wednesdays. Like I said, the survey will pop up right after we quit this. So please take the time and fill that out. Thank you so much. And have a great, oh yes, also I cannot forget, thank you to our co-sponsor, CareSource. We really appreciate it for you sponsoring this event and pushing the word out there to get everybody to know just how important this initiative is. All right, everybody, have a wonderful day.